Hi, I'm Bill Kristol. Welcome to Conversations. I'm very pleased to be joined today by Marc Lipsitch, professor of epidemiology at the Harvard School of Public Health, director of the Center for Communicable Disease Dynamics there, a leading scholar, student of epidemiology generally, but a commentator on our current problems and the current situation. And I'd say personally, as someone who's followed not a scientist and not a physician, who's followed a lot of scientists and commentators, I think one of the most thoughtful and interesting. So I'm looking forward to this conversation. Marc, thanks for joining me.
Thank you for having me.
So let's get right to it. How bad is the situation we're in, and how did we get here?
Uh, in the United States, we're in a bad situation, and we're here. Where it's bad in the sense that we are in almost every part of the country seeing growing, either high or growing case numbers, or both. We are at a point where the potential to reopen schools in the fall is being threatened, and in some places already has been uh, made impossible by the extent of transmission. And we have lost 150,000 people, or more, probably more, that haven't been recorded for various reasons. And the worst part of it all is that much of this is self-inflicted. We didn't cause the virus to start. We didn't. We didn't make the situation begin the way it did, but we have really led the world in responding badly to it, in the sense that most of East Asia and most of Europe have responded much more intensely and in a much more unified and strategic way than we have brought transmission under control to a large degree, not perfectly, and they are themselves dealing with, in many cases, resurgences as they have begun to loosen up the control measures. But they saw a threat coming. They responded comprehensively and built the infrastructure that needed to be built if they didn't have it already. And we have really, as a country, lagged. And one of the really remarkable things is the within country, and indeed the within region, within state variation in the impact of this. And a lot of that is due to socioeconomic differences, but a lot of that is also due to political decisions at the state and even more local levels that have influenced how well we've dealt with this.
Well, let's go into that. Somewhat depressing, since one would have thought, maybe I think you would say, wouldn't you say 6 or 9 months ago, that the United States, we have a pretty effective public health system and expertise and bureaucracy and medical abilities, and it's sort of amazing that we're doing worse than so many others. Not amazing isn't the right word, but depressing. Anyway, just to be clear, though, we're having this conversation, I think it's August 4th, right? So just so people can locate where we are. So let me talk about that. I mean, obviously, no one gets everything right, and people made mistakes, and presidents have their own biases, let's say, and CDC and bureaucracies have their own, inefficiencies and biases as well, actually. I mean, how much of the criticism is kind of cheap shots or second guessing? I mean, how much really what would you say the key things where one has to say, look, we really could, it wouldn't be unreasonable to have expected us to do much, much better? What are the key sort of almost inflection points or areas where some places you probably can't control too much, right? Or you have bad luck, but other things policy really matters.
I think, my predictions might have been a little bit more pessimistic, even at the outset, in the sense that we do have a world-leading CDC. It has been handcuffed prior to this, not as much as during, but even prior. It in one of his first news conferences, maybe the first, President Trump said, it's fine to lay off people from CDC because you can just get them back when you need them. It has been not encouraged to be the excellent place that it was, for example, in the 2009 flu pandemic. And we also have tolerated for decades growing and very stark disparities in people's health in this country along the lines of race and income. And those have, we couldn't have known this too much in advance, although it has happened in previous pandemics, but those have been the lines along which this pandemic has had greater impact. Those who have less wealth and less ability to social distance and less, and people of color have been more likely to get infected and had worse outcomes when they do get infected. And it's not only income, but that's a piece of it. So those, I think, were some of the starting points in January when all this happened. And I think it's not cheap shots when the entire rest of the developed world does something better than the alleged greatest biomedical power in the world. It's not a cheap shot to say we should have done better. Indeed, it's quite amazing to have done worse. And I was asked, there are indices of pandemic preparedness, on which the U.S. and the U.K. were near the top, and many of the countries that have done better were further down. And I was asked, how could we have gotten it so wrong? And my interpretation, and you could disagree, and there are probably other factors, but my interpretation is that country is not the right unit of analysis for pandemic preparedness, but rather country and current administration, because without a strategy to deal with a problem, a comprehensive strategy to deal with many aspects of a problem, the best laid plans are of no use. And we did have good plans, and we did have good infrastructure, and that's been not used because we chose not to. The strategic vision has not been there, even still, and certainly was not there in January when we all began worrying about this.
No, I mean, my prejudice as a political scientist is to say that politics matters and policy matters, but I mean, the devil's advocate position is, well, one wants to blame whatever a president one doesn't like and so forth. But so just go into a little more depth on that. What were the key, there are many failures, I'm sure, and shortcomings, but what would be the two or three that just really leap out? And that, as you say, we do have it's not as if we're doing this in a vacuum. Other countries of similar wealth and lesser wealth, really, and lesser biomedical preparedness, you might say, have done better. So what core things did they do right that we didn't do?
I think the one that really stands out, just because it's such a catastrophe still, is quick and accurate testing. And I wasn't even as sure about that when people were jumping up and down at the beginning and saying we need more testing. I was joining that, but it was sort of because I trusted other people more than because I had a real sense. But as we see now that we just don't have a clear picture of how many cases there are, and that contact tracing is being attempted in places that have way more cases than they know about, and that are not learning about those cases in a timely fashion because the tests take so long. To be doing that 6 months into the epidemic is probably the most dramatic failure in my mind. And that started with a decision at the CDC. I don't understand how that decision was made to go our own way in designing the tests, but that could have been corrected by an administration that was strategic. And I think that really points to the other piece, which is just, this is a hugely multidimensional problem. It's an economic problem. It's a school and education problem because of closures. It's a medical problem. It's a public health problem. It's an industrial policy problem to get supplies that we need. It's a mental health problem. It's a health disparities problem. And you really need people who are all rowing in the same direction, who have the mandate to make it work on all those dimensions as best we can, given the difficult circumstances. And instead, the strategy, such as it was to close the border, blame China, and then start bidding wars for ventilators. And that was not a strategic approach. It was quite the opposite of a strategic approach, and denial. And that was the other piece of it.
Yeah, I want to actually talk about testing some, which I, knowing nothing, also just kind of instinctively thought, well, that seems like the one thing you should be able to to do. I mean, vaccines, I don't know how long that takes, and therapeutics is obviously we learn as we go along, but that's complicated. And herd immunity, I wouldn't have the foggiest idea of how to judge when that happens. But testing is the kind of thing a huge country with a massive manufacturing capability presumably should just, that's one where the government sort of like making airplanes in World War II, right? It feels to me like, and knowing not much about it, that's the kind of thing we should be good at. We may not be the most brilliant tacticians, and we might always make the right decisions in the heat of the action, but we should be, the idea that 6 months in we don't have quick and reliable access either to the sophisticated tests, if you want to worry about the individuals, or about the kind of mass testing or screening, maybe is a better word. Maybe, I don't, am I wrong to be kind of appalled by that? And I guess, and say a word also about the different kinds of tests, because I think that's been an interesting, that's risen to the fore, it feels to me like in the last 2, 3, 4 weeks, the notion that we have these very sophisticated tests, but we can do a lot with much more rudimentary tests.
Yeah, I think that's a really important point. So there are, yes, it is shocking how just, even for friends who are trying to travel from one state to another and need a test to get into the other state, it can be weeks before you get the answer to your test, and that is an infrastructure that's not working. So, and that's for people who have the means to pay for their own test and all of that. So, for contact tracing, it's even worse. So, yes, it's a problem. The different kinds of tests are a really interesting issue, and there are all sorts of regulatory and scientific aspects that are interesting about them. But more or less, if you're talking about viral tests, which tell you whether you currently are making virus, meaning that you could be infectious to others, there are PCR tests, which take the genetic material of the virus and detect it, and which tend to be very, very sensitive, meaning if the virus is there, even in small amounts, because PCR stands for polymerase chain reaction, they take a small amount and amplify it. So you find the virus if it's there, the genetic material if it's there. There are also another set of tests called antigen tests, which find the protein, the virus, the body of the virus itself, and some of those are a little bit less sensitive in the sense that people might be positive on the PCR but not show up on that antigen test. Those are nonetheless exceedingly valuable because people who are just a little bit positive on the PCR, you probably don't want to know about anyway. They're not likely to be infectious. It's not 100%, but more or less, these less sensitive tests are less sensitive to people you don't actually want to identify. So they're sort of technically making some virus, but they're not likely to be very contagious, if at all. And very widespread use of the cheaper, faster, but less sensitive tests would actually be more sensitive as a whole. The system as a whole would be more sensitive because it would detect what you want to detect, and you could do it much more frequently. So there's been suggestions by my colleague Michael Minna and others that this is a really valuable approach because it focuses on the people who are most contagious. It could be done cheaply and quickly. And I think the idea is beginning to catch on, but time's a wasting.
And how hard so I think the idea here is that you could test everyone basically in a school almost every day, right in a classroom, and be somewhat confident that if everyone's negative, then you can go right ahead with your business, and you don't have to have super expensive, super fancy tests and wait for people to show symptoms and all that. But how close are we to something? Is that, I guess, is that?
Yeah, I mean, it might maybe not everyone every day,
Yeah.
but it would be much more frequent and much more widespread.
Yeah.
And I think it's technically possible. The manufacturing has to be done and the money has to be spent. But it's, as my understanding is that we're not far from being able to do it.
But how long would it take? Let's say if we had an administration that said, boy, we want to open up, and I want to get to this in a minute, schools and businesses, and give people some confidence and some justified confidence, not 100% assurance, but justified confidence that it's a reasonable place to go work or to send your kid or go work yourself if you're an adult and so forth. I mean, do you have a sense of how far are we from this? Are we just?
I don't know the answer to that.
But we're not. But we're not close.
I think we might be. I simply have
Yeah.
not done the research to answer your question, so
Yeah.
I don't want to answer it wrong.
But it's a
I
production.
think we might be close.
It's a production
not,
issue,
we're
not a
far off.
scientific issue. We
Exactly.
don't need scientific breakthroughs to do this. We just need to produce
Right.
unbelievably large numbers of
Right.
cheap tests.
But they're paper strips, so it is feasible to do it reasonably quickly. Very special paper, but they're paper.
Yeah, right. And generally, it is kind of amazing that you'd think that, I don't know, just 6 months in, people we both know, friends, I'm sure you have some in the same situation, waiting a week to find out if they have it, isolating everyone who's with them, has been with them, isolating, not knowing whether it's wise to do or not. It's very hard to get back to a functioning society, really, when with that level of uncertainty on this such a basic question, right?
That's right. Yeah. And again, it's really, I mean, other countries are not in such dire straits. This is self-inflicted.
So let's talk about school and business openings. You wrote a paper arguing that we really should try to open, especially elementary schools, if we can. It's important for the kids' well-being. But so this is August 4th, as I said. We're actually looking at openings, I think, in some states and localities very soon, or openings or non-openings within a week or two. In some places, more like a month. What's the situation? I mean, what is it? Where are you on that debate of open it all up versus, no way I'm setting foot anywhere near these places and so forth?
Right. Well, as we discussed, there's real variability across the country and even across counties within a state. And so I think it's clear there are some places, mainly in the Northeast, but there are a few other patches around the country, where incidence remains low enough that it seems like the default would be to open and at least primary schools, and then monitor very carefully. I think the vast or a large part of the country is in the area where reasonable people can disagree. I am married to an educational ethicist who wrote the paper with me. She was the main author of the paper, and have had a lot of discussions about the value of keeping schools open, especially to the least advantaged among us. And so I think I'm probably put more weight on the need to maintain education, especially when you look around the country and see the sort of setups that are planned for not in-person education, for remote education. It's pretty limited in a lot of places.
And we provide a lot of social services to lower income kids and families through the schools, right? So if they're not physically there, if they don't get their lunch and free lunch and so forth.
Yeah, it's lunches and physical therapy for some, and other types of services. So there's a lot lost besides the education, and I think the challenges of doing good remote education are incredible, especially with limited resources. So I think there's room for reasonable disagreement, because it's also the case that much of the country is in medium to high transmission phase right now, and meaning large numbers of cases per population per day, and so I think it's a real dilemma, and where you draw the line is a hard question. But again, if we are opening nail salons and opening gyms and opening white-collar offices, it's really hard for me to imagine how you defend that in the face of closing schools. I mean, it's an inversion of sensible priorities. Those are not necessary. Society can function without them, and society really can't function without schools, among other reasons for their childcare functions, even if you put aside the education. So to have a policy of reopening because the lobbyists for the nail salons are more powerful than the lobbyists for the non-existent lobbyists for the kids, that's not a good situation.
I mean, I suppose the defender of the nail salons would say that adults choose to go or not go, and they go one or two at a time, and it's just a different kind of problem than having 20 students or 10 students in a classroom, and the buses and the just as the massiveness of the school system situation is a little unlike the voluntariness and more manageable character of, I mean, that would be the argument, I suppose,
Right.
of some of these
Yeah,
businesses.
and I don't want to pick on nail
No,
salons.
I
There's
know,
nothing
but
wrong with nail salons, but my point is that if we wanted to get cases down, what Europe has shown us is that a couple of months, which is a long time, I admit, but a couple of months of significant reduction in people's contacts of the European style lockdown gets you about a tenfold reduction in case incidence. Very rough terms. That would get us almost every place in the country to a level where we would be reasonably comfortable opening schools. In the meanwhile, what we're instead doing is saying, well, maybe we can just sort of skate along the edge, and maybe if we have only half the restaurant capacity, it'll be okay. But we're still having growing numbers of cases in many places. That does not work. So I think what I'm advocating is not to pick on the nail salons, but rather, if we care about education, and it's hard to think of anything that's more important to our society than taking care of our kids, then we should be really making sacrifices in the adult sector to bring case numbers down. And I hate that idea. I do not want to be stuck in my house any more than anyone else does. And I don't think that's easy, and I don't think it's economically exciting. On the other hand, having this continuing cycle of up and down for the foreseeable future, because we don't have the discipline to really bring it down, seems worse economically and certainly worse for educational outcomes.
And worse for health. I mean, right, it's the worst of all I mean, it's a little bit the worst of all worlds. It's not the worst. The worst would be to do nothing, literally, I suppose. But I mean, it's a pretty bad,
it's not good.
Pretty bad of all worlds. A colleague of yours, I mean, not at Harvard, but a fellow serious scientist said, he said, sort of just to sharpen the point you're making, I'm curious if you agree. He said, if we had a parliamentary system, not to pick on the current administration, but on the other hand, why not, And the Trump administration fell, and some new, because of its management of this, and a new administration came in, maybe, I don't know, bipartisan, good government, whatever, following science stuff, and just said, look, we just need to shut down back to kind of March, April levels, maybe, of shutdown even. Not everywhere, but in parts of the country, and lesser levels of shutdown, but still serious in other parts. But for 6 weeks, 6 to 8 weeks, and just, we're going to suck it up, we're just going to do it. At that point, this person said, we could open schools with quite a lot of confidence, and other things actually with reasonable confidence, and you just need to do it right for this period of time. It's not, despite our bungling and stuff, it's still not unmanageable, but of course we don't have a parliamentary system, and it doesn't look like that's happening and so forth. But do you sort of agree with that, though, in principle?
Yeah, I mean, I think that's what I was more or less trying to say. I would maybe tinker with it a little bit and say, some parts of the country never really got a decline in cases. They never got transmission down to the point where where the number of cases was going away. And so I think in some places it would have to be more intense than we were in March and April. In some places, what we had in March and April might be good enough.
Interesting. And what about those places that are, so, I don't know, Miami and Houston, they don't seem as bad as New York was in March and April in terms of deaths, certainly, and maybe overall infections. But they're certainly not in good shape. I mean, how bad is the situation? How much should we be a little bit heartened that we don't have the same level of deaths? And it seems that it's not quite as out of control. We're not going to crush the health system and so forth. Or is it just, I mean, but still bad. I guess how alarmed should we be about this, and where does it go? I guess is my question. I mean, if we have the current level of, muddled responses, let's just say, and maybe a little more responsibility because people are a little more alarmed than they were 6 weeks ago in Texas, but still not a real coming to grips with it. Where are we in 4, 8, 12 weeks?
I think you're right that probably the situation is less bad in some of these places because we've learned some things from New York's experience and other places' experience. Doctors have a better idea of how to keep people from dying, fortunately. And to some extent, I think the nursing home situation has gotten better, so that the proportion of people getting infected in nursing homes is less. Maybe That's an impression rather than a hard statistic. And so, and because those people are at the highest risk, you can have a raging epidemic and have less fatalities as a consequence if it stays out of the nursing home. So I think there is some progress, but on the other hand, it does not feel to me like the states that are hardest hit are universally responding the way that New York did. So I would expect the peak to be more sustained in those places until they really decide to take action to lower transmission.
I guess the two Deus ex machina, whatever the plural of that, Dei ex, whatever that would be, that people hope for are a vaccine, obviously, and herd immunity of some kind or another. So say a word, if you would, about each, and what do you think the prognosis is for either, and how to think about, I mean, vaccine is a scientific question, but how to think about herd immunity, which is an interesting public health and question, it seems to me.
Well, so herd immunity, I mean, there are two sides of the same coin. You can get to a vaccine, to herd immunity through a vaccine, or you can get to herd immunity through natural infection or a combination. So that the vaccine alone is no longer an option because everybody's got some level of transmission. So it's a question of whether we get there mainly through natural infection, only through a natural infection, or with the aid of a vaccine. There's a lot of discussion recently about exactly how many people have to get infected for herd immunity to take on to sort of kick in. And for those few people who haven't heard the term, it's almost become common parlance these days. But herd immunity is just the existence of enough or of a number of people in the population who are immune and therefore break up the chains of transmission that would otherwise occur, because when they get exposed, they don't get infected, and so they can't transmit. And classically for measles and all the other childhood infections, we create that by vaccinating people. When the disease itself creates herd immunity by infecting people, it does so more efficiently than if we just gave out vaccines at random. And so there's been a lot of discussion about whether maybe we can get to the level of significantly reduced transmission while not having that many people immune. I think the plausible estimates of how many people have to be immune before transmission would cease in the United States are at least at the 40 or 50 or 60% level. There have been some estimates that are lower. I don't agree with those estimates. There's a lot of uncertain assumptions that go into each of them, and that's why I give a range rather than a number. Mm-hmm. And it also depends on how good the immunity is from natural infection. We've seen lots of reports about people's, at least antibody levels, declining after they get infected, which is natural, but the question is how much their ability to fight off the infection if they're exposed is declining, and that we will have to just wait and see. So there are a lot of uncertainties in both directions about herd immunity, and that's why I would be cautious about giving a precise number, but we don't want to get even half the population infected with this virus. We've seen with 10 and 20% of the population getting infected in places that you get a lot of casualties from that, and doubling that or more is not something anybody should want to do. So a vaccine is certainly the thing we would like. As you know, there are phase 3 trials beginning on multiple vaccines, which are the large-scale trials that would test their efficacy. The early results from several vaccines have been promising, and that's certainly good news, but there are enough historical precedents of vaccines that look good in the early phases but don't pan out in efficacy trials that this is still an open scientific question. And it's going to be really important as the news builds that this looks good or this is promising, that we adhere to a careful process before trying to roll out a vaccine. I think there's been a little bit of discussion. Maybe we should just let people start trying untested vaccines, and I think that's not how we do it for a very good reason, which is that until you've done the study, you don't know whether the vaccine is helpful. It could be harmful, and we just need to know on a phase 3 basis, the big efficacy trials, whether the vaccines are useful and whether they're safe when given to lots of people before we start to give them to even more people.
And you mentioned rolling them out, and people talk about that in a somewhat cavalier way, but I mean, isn't that a pretty big task? I mean, we're to vaccinate tens and hundreds of millions of people, and I mean, just that itself is a challenge, or is that pretty manageable once we have it? I mean,
well, I think that also remains to be seen. I think for those who are vaccine enthusiasts, so the first thing is there's a whole world out there of 7+ billion people, and we are not entitled to the vaccines over everybody else. That doesn't mean we won't try to sequester them, but it's not our moral entitlement to first in line for the vaccine. And I think there will be a very complicated set of international maneuverings that could further damage the international diplomatic and social fabric. But at the point where there is a vaccine supply for the United States, those who are enthusiastic about it, I think, will probably be able to get access reasonably quickly. There's a lot of vaccine hesitancy about this vaccine, even more than others, I think, in part appropriately. I mean, sensible people are hesitant about a vaccine until they know it's good, and we don't know that any vaccine is good. So there's a nicer interpretation, but I think there's also a sense that a lack of trust in the medical system and other reasons why people are hesitant. And if we're going to use it as a public health tool, we're going to have to solve that and give people a sense that it's being used equitably and that it's actually beneficial for them and for the community that they're in.
Yeah, I mean, just putting my Kennedy School hat on, I guess I taught that just a couple of years, but I mean, to try to learn a little bit about what they call public management, and not the sort of what the right policy is, but how do you implement the right policy. Yeah. I mean, it just sounds to me like this is something with even a very good administration that really is trying to send the right messages and not mixed messages, and cooperation at state level. And I mean, that's a pretty big effort. I mean, doable presumably, but we're not talking about snapping your fingers and everyone getting a vaccine one week and and then everything opens up. I mean, it's
and some of them are 2 doses, so that adds to the logistics. But I think the public trust issues are going to be complicated. I think the fair distribution issues are going to be complicated. I think it may be just that this is not what I do, but I think the logistics are kind of the least of the issues.
No, I think the logistics. Yeah, that sounds right to me at the end of the day. But of course, it could also be without public trust. Something will go wrong somewhere in some distribution of it, and someone will get sick and die. I guess no vaccine is right. I mean, people have unexpected adverse reactions and so forth, and then everyone goes into a panic and they freeze I mean, you can just imagine a lot of nightmarish scenarios without good leadership.
Yeah, you can, and again, there are systems in place for other vaccines to track those and try to figure out if an adverse event that happens to people, things happen for all sorts of reasons. You want to attribute it to the right cause, and so there are systems that are pretty well developed for that. And in a more sane time, I think people would have had more trust in that. But I think those systems are trustworthy and can be used for this as well. And the question is only whether the people in charge are rowing in the right direction.
Yeah, one does come back to that, and I will come back to that in a minute. But I have one question on the immunity thing, and I just, as a kind of layman, so it's a novel coronavirus, right, which makes the us all more susceptible to it than to other things that are going around, where we have
Yeah.
built up some immunities, many of us at least, or some of us, over in some different degrees, I guess, over, because but how? I guess, but on the other hand, there are the coronaviruses, if I understand it correctly. So
Yep.
how novel? I mean, isn't that important for the herd immunity issue? How novel? I mean, are we all just sitting ducks for this if we get it, or are there more immunities there than perhaps we thought ahead of time? Is that why so many people are asymptomatic? Why one family member doesn't get it when another one does? It's I don't know.
It's a good question, and as a matter of scientific proof, I think there are competing scientific hypotheses. One is no existing immunity is of any use against this. Another is that there's some partial protection from prior coronaviruses. It's really difficult to tell. I think the study could be done, but it will be a big challenge to do it because you really have to look at people's immunity before they get exposed and then see who gets infected, immunity to other coronaviruses. I think some of the much of the discussion about herd immunity has been about whether some people just are already not susceptible. I think the outbreak in the Georgia summer camp that was reported recently, where over 50% of the people at that camp got infected during that outbreak, shows that at least half the population in that camp was susceptible enough to get infected when there was an outbreak. And it is typical of outbreaks that they do not infect everyone because eventually herd immunity does start to take over. So seeing 50% of a population there and in some other settings, large proportions of the exposed population get infected, to me makes it seem unlikely that there are large proportions who are not at risk. But I think as a formal matter, there is still a bit of uncertainty. But I think there's no real evidence at this point that large numbers of people have protection that they don't know about. I think it's just, fortunately, it's less contagious within households and within other settings than it might be.
And if that camp had been in the New York area, where presumably there's the highest level of some antibodies, would we see that kind of outbreak, or we just don't know?
I think, it depends on who the people were because there's so much variation in New York, but the amount of herd immunity in New York as a whole probably would have made such an outbreak smaller. Probably not stopped it, but made it somewhat smaller.
But New York had the worst situation, and therefore the most, I suppose, is the most. So a huge part of the country is unfortunately very susceptible to this. Is I guess what we're.
Yeah.
So where do you think? 2-3 months in terms of school. I guess short-term school and especially school openings and universities, for that matter, businesses. Where do you think we are 2 months from now? Are we? It will differ, of course, across the country, but
Yeah. It really depends on our choices. This is why it's different from hurricane forecasting, is that we can make our predictions come false, and we should, because the predictions, in the absence of really taking action, are not compelling. If we continue on a sort of modest amount of reclosing in some places trajectory, like California closed their bars and a few places have made modest backtracking on the reopening, and then we reopen schools and universities, I think we're going to be in a worse position in 2 months than we're in now in terms of the amount of viral transmission. If we decided to really shut down large sectors of the economy for another 2 months right now, and tried to get transmission down, and try to be smart about it, and only really use the evidence we have to target those closures so that we don't wreck parts of the economy unnecessarily. then I think we might be in a situation that's closer to what Europe was at the beginning of the summer.
Yeah, unfortunately, that first scenario seems a lot more likely to
Seems
be
much
for
more
the
likely,
next, at least for
yes.
the next 2-3 months, but really, unfortunately, for the next 5 months, I suspect, which means an awful lot of pain and suffering of all kinds, right? I mean,
Yeah.
it's on Europe. Just to get clear, there have been these resurgence, I guess, and new outbreaks. You regard that as reasonably manageable, given that they had got it so suppressed. I mean, and that they're going to peak much lower than our
I think so. I
outbreaks.
mean, it depends on their response as well, but it's also much easier. It's not easy, but it's less impossible to control a small resurgence than a big one. I mean, I think in the United States, uh, I mentioned contact tracing a little bit earlier. The enthusiasm for contact tracing seems to wax and wane, but be greatest when we have the biggest problems. And in fact, it's the most useful when we have the smallest
Yeah,
problems.
that's an
It's a
interesting
good
point.
mopping up approach, but it's really not a main control approach. It's the paper towels to clean up the the remaining spills after you've used a mop.
Yeah, that's so interesting, and I think there was an awful lot of focus on contact tracing because people were familiar with it. I have the sense from previous, from the AIDS epidemic and from other instances
Yeah,
which were where it was more appropriate. I think, and more of a limited group of people, presumably, that were most susceptible and so forth. But yeah, it is a bit of a. It's interesting. Let's just divert on this for a few minutes. I'm sort of interested in, again, from my kind of Kennedy School point of view, the public health, the way of thinking about it as from the point of view of public health, is really quite different from the way of thinking about it as a physician. I mean, as a physician treating a patient. I'm sort of struck by that, and I think people might be interested. I mean, talk a minute about thinking as a public health expert, as opposed to just being a doctor.
right. Yeah, I mean, fundamentally, both approaches are trying to reduce disease, but the sort of universe for the treating physician is centered on the person in front of them, the person to whom they have a duty as a physician to help them and indirectly help their families. From a public health perspective, we sort of take a wider lens and it becomes about the numbers, not because we don't care about individuals, but because we do care about individuals, especially large numbers of individuals. And so, to take the example of contact tracing, there is no doubt that every contact traced and successfully isolated is a victory because that means somebody who's less likely to transmit to others. But from the public health perspective, the question is, does that system as a whole noticeably reduce transmission in the sense that if we're going to invest the money to do it, is it providing the return that we need in terms of taking the reproduction number, the number of cases each case infects, and bringing it down a lot? Because when we bring that reproduction number down below 1, we can get the number of total cases to go down. And when it's above 1, it's going up. And going up slower is good, but we really want it to go down. And I think the difficulty is that in most parts of the U.S. that are doing contact tracing now, actually there's not a lot of data provided, but where there is data provided, a large percentage of people, like sometimes half, don't ever don't ever respond to the contact tracers. Another factor of a half gets lost because people's contacts often don't respond when they get named and traced. And the whole thing is done very slowly with these huge delays in testing, so that even when you do find contacts, you often find them after the transmission has already, after it's too late to stop transmission. And when you add up all those pieces, of course, there are some individual victories, but it is not a system that meaningfully reduces the spread of the epidemic. And I think a lot of people in public health have been frustrated because it's obviously more attractive than lockdowns to politicians because it inconveniences smaller numbers of people, albeit more intensely. And it sounds good, and it's what's worked in other settings. But again, in a well-resourced, properly set up setting, it can work, and it is working in some places, but not when you have 3,000 cases a day that you know about, and most of those people don't answer the phone, to put it really bluntly.
And on the public health side, I guess what's been so infuriating to people like me looking at it from the outside is it does seem to me that, I mean, correct me if I'm wrong, obviously, that we know and there's a reasonable consensus on how to do this, at least in the broad strokes. I mean, obviously, there could be endless disputes about tax details and allocation of resources among different, parts of the public health network and so forth. But it isn't like, I don't know, international relations, a field I know a little about, where, people really do have fundamental disagreements about what keeps the world safer and more or less intervention and this and that. And it's not as if there's just you can just take advantage of a body of expertise and, apply it and feel pretty good about the likely outcome. It does feel to me like this is a discipline where, but correct me if I'm wrong, that we've learned a lot, and we know a fair amount, and there's a reasonable consensus across the nation and the world, I think, and among serious experts, and we just chose to ignore it in a way. I mean, is that oversimple or?
Yeah, I think it's probably roughly. I think it's roughly right now. A serious economist once described to me that much of what economists in government do is figure out which of the different theories in Econ 101 is relevant to the current situation. That it's not that that it's about applying simple theory, but you do have to figure out which simple theory.
No, that's a good way
apply.
of putting it, actually. Yeah,
and I think at the beginning, we didn't know which simple theory was going to be right. We were worried about hand washing, and we weren't emphasizing masks, and we made some mistakes about what might be necessary. But a lot of that was due to let's try to do everything. I mean, masks are a special case, but let's try to do everything because we don't know what's going to be important for transmission. And I think we're beginning to learn now from the places that have had success what really matters. Although some of those places really did throw the kitchen sink, and I think we can also be a little bit more choosy than say, Spain, where you couldn't leave your house without permission. So I think now we do know because we've seen success of various sorts. I think at the beginning, the right thing to do is not to say we know what the properties of this virus are, because we didn't, but rather to say we know that this virus is going to cause outbreaks, almost certainly cause some outbreaks in hospitals. It's going to cause outbreaks in vulnerable populations. We can guess what those are. Even if we don't know for sure, we should try to make safeguards against those. We know that the response is going to have economic consequences. We need to deal with that. So I think there are a lot of big picture things that you can do, and then you get the tactics more and more precise as you learn about it. So I don't think we should have had it all right in January. I think we should have had a plan in January.
Yeah, that sounds right. I mean, of course, one's going to get the tactics wrong, if you want to put it that way, the relative importance of different things, but you just don't know the actually as much about the virus as you're going to learn. But I guess what sounds to me like what you're saying is now there really is much less excuse for not dealing with it. Well, we know most of what we have to know in terms of what would really, as a matter of public health, be efficacious in very much reducing the spread, not eliminating, so reducing the spread of this. Is that right? I mean,
I think that's
this is
right.
not a problem anymore of we're mystified. It's something that came out of nowhere, and who knows how it works.
Right. And I think, a slightly nicer spin on what's happened over the summer is that we've been experimenting and trying to figure out how close to the edge you can skate while keeping the virus under control. And I think the answer is that where we are, even in the Northeast or in Massachusetts, where case numbers are inching up right now and have been for a while, the answer is, that is the edge, that our current level of open society, openness of society, is a little bit too much if you want to keep viral numbers, case numbers steady. And so we need to move backwards. And some other places are way more open, and nobody's wearing masks, and they're having worse outcomes. So I think we have learned over the summer that you can get away with a little bit of reopening. You can't get away with full reopening if you want to keep case numbers steady or declining. And I think it's going to get a little bit worse as the winter comes, because I think seasonality will drive it a little bit. But I think we have gotten some evidence through the summer of where the amount of transmission, what the balance is between openness and transmission.
But it seems to me, looking from the outside, that there's not enough alarm about that evidence in places where, not Massachusetts, where there's, it's on the margin perhaps, but where it really is now going up in a big way, and not enough willingness, I'd say, to do big things to tighten back up, as opposed to some reasonable suggestions that are better than not making reasonable suggestions, I suppose. And B, and you sort of hinted at this earlier, but just that it's not as if this is, I don't know, you don't get to play, you don't get to stay pat, right? You don't get to say, let's just have the current level. We can sort of live with that for X amount of time. I'm leaving aside the moral considerations or the ethical considerations, but because this is a virus, a communicable disease, a virus, and it goes up if it doesn't go down to some degree, right? I mean, it just feels to me like what you're saying is not encouraging for the parts of the country that really are seeing serious outbreaks.
No, I think there is not enough alarm, and we really need to, if we're serious about controlling the virus, which I think even those who care only about the economy should be. I think it's not a choice of economy or virus. I think we have to get the virus under control so we can have an economy. Then we need to be doing more to control it right now in almost every place in the country.
Yeah, I feel like that's a good clear statement of that. I mean, I feel like the economy, there was that sort of what I would regard as kind of a phony debate about the economy versus public health, and 3 months ago or so. I do think people now understand much better that you can't have a flourishing economy without some baseline of reasonable assurance on the health side. But and I think now people begin to understand you can't just reopen the schools without some reasonable assurance. But even if you do err a little more on the side of reopening, as you were kind of suggesting in some places, just because the benefits are so great to the kids, at least in some areas, and especially maybe primary schools, and especially more less advantaged kids and so forth. I mean, even so, it's a free country, right? People can choose not to go and not to work, and we don't want to make people work in places that they don't want to work. It's not the way America works. And so it's not, again, if you don't have sort of basic confidence and trust, it's not going to work very well, even if you do sort of at the macro level say, let's err on the side of reopening, whether it's businesses or schools. So all that, for me, just makes me more alarmed and have more of a sense of urgency. But I feel like people now, they're not really making the opposite arguments. They're just in a weird kind of fatalism almost. It's sort of, well, I don't know what we can do, and it's a mess. And here in Fairfax County, where I live, the public schools are kind of putting off the decision for a month, and they might go half and half, and it's very complicated. And I feel bad for the administrators who aren't. This is not what they were trained for, right? To make complicated decisions in public health, and how many kids, and how do you run a bus system when you can't test the bus driver every day and 25 kids are getting on that bus, and if there's only 10 kids, how do you get 3 times as many buses? I mean, you're talking serious problems of just management that, but anyway, all I'm saying about that is that I'm struck by a little more of the fatalism and a little less of the sense of healthy alarm around, and people just say, okay, I guess we're just going to put up with this for a few more months.
I think I feel the same thing. As I was writing the piece in the New England Journal with my wife and with our colleague Muga Jevic from Scotland, I felt as though, we took as our question, how can we reopen schools? And I felt as though someone had asked me, how do you climb a mountain? And the first answer would be, well, with really good equipment and ropes and a helmet and all of that. And then the question was, no, how do you climb a mountain without any of that? And so the next answer would be with, good hiking boots at least, and on a nice day. No, but it's pouring rain, and in fact, not only do you not have hiking boots, you also have to do it on your hands and knees. So how are you going to climb the mountain? And the analogy is simply that we just have deprived ourselves of the basic elements of public health for no good reason. Other countries have managed to do it, and we're now trying to answer an unanswerable question, which is how do you keep the society functioning, and one of its most important elements, which is the schools, with all three hands tied behind your back. And it's just not a fair question to ask anyone.
Yeah, I thought the schools would be a huge moment, schools and universities, just because, if you just look at the numbers, an awful lot of people are in them, and an awful lot of people work at them, and a lot of people have relatives in them, and so it just affects everyone. And so I thought this would be a wake-up moment, and I kind of keep waiting for the, oh my God, we just can't go on the way we're going. But I wouldn't say that I see among the people I talk to who are more on, one side of the political spectrum these days, more willing to be critical of the administration. Of course, I hear similar expressions of frustration, but I can't honestly say, stepping back, that I see a huge mobilization of, oh my God, we got this wrong, but now we're going to get it right. I see a lot of, we kind of got some things wrong and we should do better. As you say, we should get the better hiking boots and, be a little less irresponsible. We shouldn't cavort up the mountain barefoot, but our people just, I feel, and maybe that's an indictment a little bit of our overall political culture and civic culture, not just of one administration, or maybe it's an indictment of one administration, of how hard it is to do it without political leadership. I don't know, but it feels, it's frustrating to me watching. It's one thing to get it wrong in February and March, but to be doing what we're doing now is...
Yeah. Well, I think we've had a dumbing down of expectations. I mean, the last time that there was a serious effort in the national interest to do anything was not in recent political memory. And we've just come to accept that the administration will take action for all sorts of reasons, but we shouldn't expect the national interest to be one of them.
No, that's well said. I guess it's both the dumbing down of lowering of expectations, but also maybe overconfidence. The public health we've sort of done pretty well, I guess, and I don't know, correct me if I'm wrong, in the recent challenges of one has the sense in 2009 and 2014, and so there was kind of a, but that was without any great national mobilization, obviously, because they were very different challenges, I guess. A little bit in 2009, but I don't know. To say a little bit about that, the history. So in a funny way, it's a weird mixture of overconfidence that we don't have to do quite as much, and then an unwillingness to do what we have to do.
I think 2014 is a different kind of thing because a tiny proportion of Americans actually had any direct effects. It was far away and fortunately did not spread any more than it did, despite having spread incredibly widely in 3 countries. And, it's almost churlish to say, but Ebola is an easier disease to control than SARS-CoV-2 disease because people are more noticeably sick when they're transmissible, when they're contagious. Which is not to minimize the horror of that event, but it was ultimately controlled by straightforward public health measures, heroically applied. But 2009, I think, is a better example. It turned out to be much less of a problem than this one, and not only because of our actions. It was a less bad virus in almost every dimension. But the response was also much more coherent. It was science-based. The public health practitioners and experts were out there talking to the press and to the public every day without political interference of a major nature. And there was, I was at CDC in the first month of May of 2009 when things were getting serious. with the flu pandemic, and I think there were 1,300 people at CDC mobilized to work on this problem at some point. I don't know when that peak was hit, but there was somebody thinking about every single thing in public health that was relevant: how to deal with schools, how to deal with antivirals, how to deal with doing studies, extensive studies of the epidemiology. And some of that is happening now because CDC hasn't been utterly shut down. But the fact that it was completely, but in that event, it was completely central. And in this event, it's completely sidelined.
And you all and others are doing these studies and writing articles, so maybe that picks up for some of the the limits of knowledge that are coming out of the federal government, I suppose. But at the end of the day, the action, you can't do what the federal government does, right?
You can't do action, and I think academics have done a good job of picking up some of the slack that that has been left by the lack of a coordinated federal response. But we can't act. And as importantly, we can't. Most of us can't coordinate information. We don't have access to the raw data to compare what's happening in Texas to what's happening in Massachusetts, and to sort of build a national picture. Johns Hopkins has done great stuff to provide national, and other groups, Harvard Global Health Institute, to provide even county level data. But the raw data is sitting in public health departments, and the CDC can get access to it, and we can't, roughly speaking. And understanding the big picture really does require having access to those kinds of data, which only a federal agency can do. And also, the poor, unfortunate people in each county health department who have to make hundreds of small decisions with limited guidance. Again, the National Governors Association has taken a role. There are all sorts of groups stepping in to try to provide the leadership that is typically provided by CDC. But this is what CDC did on everything in 2009, and it's just not playing that role to the same degree in this case. So everybody else has to try. But no, this is a real value of a federal response.
Yeah, I'm struck by the federal side of it, and maybe we can close on this thought that I'm a believer in decentralization in many, many ways, in a Tocquevillian way, and in federalism and for many things as well, because there are real advantages to having 50 different responses and experiments and so forth. But, this seems like the classic case where this notion that got lodged pretty early, I guess, in the Trump administration, if we're going to just devolve it down to the states, I just think is a little nuts. This is it is a communicable. The disease does not understand state lines. So, tax policy, you can do competitive. Texas can have no income tax, another state can have a higher income tax, and we can argue forever about, which policies are better, and businesses move, and there's a certain kind of testing almost, you might say, in the real world or in the marketplace of different policies, and same with education policy and a lot of things. This is one where obviously, the way we're set up, there would always be a lot of implementation at the state and local level because we don't have a lot of the parts of the bureaucracy are state and local, and maybe that's a good thing. But the idea that, tell me if I'm wrong, but the states and localities are not set up to do what CDC is to do. They're very fine people, I'm sure, in the public health departments in Virginia, in Richmond, and for Virginia, or in Fairfax County here, but they're not supposed to be able to do what A, they can't do it because they can't coordinate, I guess, and B, they don't have the staff and the facilities to do what this federal government does. So it seems like the worst case to apply a kind of mindless, I don't know if it was a mindless federalism, it fit in with a certain ideological predisposition, but it was also a way of ducking responsibility, I suppose, don't you think?
Yeah, I don't want to speculate
but
on those motives, but I do think that that you're right. There are a few health departments around the country that have some of the features of CDC for their local area, but they can't monitor what's going on everywhere because they don't have the personnel and the information system. So coordination really does require an effort at the top administrative level, which is the U.S. government in our case. And and many of those state health departments uh, are are do a lot of what they do because they have guidance from the CDC, and to abdicate the coordinating role to a large degree, not completely, but certainly I've had friends in local public health say, I was on a call with CDC and asked a question about schools, and they said, you should use your discretion, or follow our guidance, which is use your discretion. And the sort of, it's all advice. States are always free to ignore, or locals, but the strong voice of public health of this is the best evidence, this is what we know, and this is what should be the most effective given that, that's missing.
And missing, I think, in education too, and in commerce. I mean, again, I worked at the education department, and I was against. I'm not sure we need a federal department of education, but in any case, I'm not for the feds running our education system. But this is the one thing where they really could have been helpful, I should say. Have a special task force and really give good guidance, or make access at least available to the best guidance for these local school boards. I mean, Fairfax County, we have a large one and a real bureaucracy that's pretty capable, but a lot of smaller ones they don't know. And private schools, and how are they supposed to? I really do feel, I mean, they're getting criticized a lot, and some of it's legit because I think they have, whatever, not been great in some cases, but I feel bad for them. How are they supposed to make a decision? I mean, and again, Harvard can make a decision because they have access to you and extremely capable people, and I think make us intelligent decisions about opening the college and the universities. But what do you do if you're a small college that doesn't have, you're not,
Yeah.
I really, it's...
Well, I might I might flip that one around. I mean, Betsy DeVos has certainly made it clear that she has a policy, a recommendation, that she will use her power of her purse to enforce it as much as she can, and it's the content that is not sensible, not the form, I think.
Well, but that's not a real policy. That's just a irresponsible exhortation. I mean, that's even worse. I agree with that.
Well,
but it's I mean,
right. But there is federal government effort to control decisions at the local level through spending. And so, I mean, one amusing thing, ironic thing is, we're all flipping around on our ideologies a little bit. I thought states' rights was a regressive concept because I'm tend to be pretty left on most issues, and now if we didn't have states, we'd be totally in much worse shape than we're in. And on the other hand, the Trump administration says it's for local control, but they are going to try to control the locals with respect to school reopening. So I think all the formalisms are falling in the face of policy outcomes, which is not a new thing, but it's very demonstrable in this epidemic.
And it would be maybe a healthy thing if it led people to rethink certain things in both ways, I suppose. But I don't know how much, and there will be rethinking, I think, and I've certainly done some. But meanwhile, just to finish up on the short term, I mean, it sounds to me that absent a pretty big change in either federal or state level policies, I guess, in some of the key states, you're not very hopeful. I mean, maybe we can muddle through without things getting much, much worse, but it doesn't seem to me like you're very hopeful for the very near-term future. And the near-term future, unfortunately, isn't so near. It's, 5 months of this administration. It does sound like you think that if one got very, very serious on January 21st, one could really make progress, because obviously in theory we should be able to do what Germany and other countries have done, right? But even that would take time and a real reversal, which isn't going to be so easy and immediate. So I come away from this with a pretty chastened view of the next 6-9 months.
Yeah, I mean, I am hopeful that we can reverse some of the damage as soon as we decide to do so. And if that's January, I'd say 20th, not 21st. Yeah, right. I wouldn't wait. Then so be it. That's unfortunate. But, we do have a lot of states and a lot of smart people and well-intentioned people in state governments. So I guess on a more positive note, every state that makes a decision, and there are a lot of people trying to do the right thing in various states, every state that makes a decision to try to control the spread of the virus so that we can open schools and eventually open the rest of the economy can make progress and will be in a better position vis-a-vis other states, just to put it in very blunt terms, if they can. And so I think, for better or worse, that's where we are. And I'm certainly trying to encourage those that I know at the state and local levels in various places to to take control as much as possible of the transmission through some unpleasant measures in the short term, in the interest of trying to have a viable society in by the time the election happens, for example.
No, that's a good point. One shouldn't be fatalistic, and we do control something, even if we don't control everything. And different people at different level with different levers of authority and ability to shape things, control at least. It's their responsibility to do what they can, and maybe there'll be some change at the federal level, and out of political desperation or something, there'll be a kind of getting more serious about it. But it is. It's just terrible to think. I feel this personally about someone who was not a fan of the Trump administration, to say the least, but a lot of it is stuff that I can see us recovering from. But here, you can't, a lot of the damage is done. I mean, it's not just a matter of, gee, it was unpleasant to go through this. Real damage to people's health and lives and livelihoods has been done. You can't get that back.
And educations. Yep.
Yeah, educations. Well, on that slightly gloomy but honest note, we can end. We should get back together. Maybe in let's see what happens, but maybe in January to really think about where we stand and then how much progress can be made, how quickly, with what policies and so forth. And this has been a very, for me, instructive talk and honest and helpful just in thinking the issues through. So, Marc, thanks very much for joining me and taking the time. You're very busy, so I'll let you go. And
all right, thank you. I've enjoyed the conversation.
Good, thanks, Marc, and thank you all for joining us on Conversations.